Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Med. Today is Thursday, July 1st. Wow, we have some, it's a birthday. We'll talk about that later.
We'll get to that.
All right, first graph, Capital Region. First graph, New York State, people in the hospital with COVID. Fred, that's 364.
Yeah.
Okay. Now the next graph is the Capital Region, and we're currently at 10. Fred, interestingly today, just so people know, we are still as a region periodically talking, and today we did as well.
That's right. So today, Dennis, we started talking about vaccines. And whether we as a region want to go down the path of mandating vaccines for our employees. So we're investigating, lots of health systems are doing this. The state of Maryland, all the hospitals in the state of Maryland have decided that they're going to mandate vaccines. Same thing with hospitals in Washington, D.C. So we've begun to think about this, talk about it, and more to come.
So important point, this is the same group that you led for the last year, all regional hospitals talking sometimes twice a day, 7 days a week.
That's right.
There was a commitment to continue to talk as issues came up. The idea of vaccine, mandatory or not, is a topic that's being discussed.
That's right.
So that's a great group. Next graph here, admissions and discharges, just to show visually, it's still 0 or 1 per day. Did you get any emails about what that meant?
Matt Surf must have been on vacation. He did not ping me with an answer to that question.
Well, it's still a relatively few numbers, 0 or 1 per day.
That's right.
And then the next graph here is AM census. So today, Fred, this morning we have 5 in the hospital, 3 in the floor, 2 in the ICU, both of those on ventilators. So we're still down to very small numbers.
Very small numbers.
All right, Fred. We mentioned on Tuesday that today we would talk a little bit about booster vaccines. I think most people are familiar with this concept. If you get a vaccine, sometimes it's necessary annually or sometimes stretched out longer period.
That's right.
You get another vaccine to kind of boost your immune system. And a lot of people have said, am I going to need to get a booster for COVID? And so you said there was an article that you had read in Nature that gives us a window into what's possible.
That's right. So I don't think there's an answer to the question yet, Dennis, but we're starting to accumulate some information. So let's start with 30 seconds and educate people about immunity. So
we call this Facts by Fred.
Facts by Fred. So there are 2 kinds of immunity. There's innate immunity and acquired immunity.
Okay.
And they kind of are what you would expect. Innate, you're born with.
Right.
Acquired, you develop.
Right.
And how do you develop acquired immunity? You're exposed to something. We call them antigens, usually a protein or virus or something. And your body creates what are called germinal centers in your lymph nodes. And these are immature white blood cells that differentiate into mature white blood cells that recognize that antigen and can produce antibodies to counteract it.
And you can be exposed to that 2 different ways. One could be by contracting it in the community, and another is through a vaccination process.
Exactly. So, and when you develop those mature white blood cells, they leave that germinal center and they go throughout your body, and they kind of hide and wait for that antigen to come back, and then they get activated. So that's acquired immunity. The Nature article looked at what happened in 14 individuals after they received their shot, and this was the Pfizer vaccine. And what they did was they took samples from their lymph nodes, and they did this over the course of 3 months. And what they demonstrated was, guess what? You develop these germinal centers that attack the COVID virus.
Excellent.
So that strongly suggests that the vaccine creates that long-term durable acquired immunity like you get with measles, the mumps, and other vaccines that we administer all the time. So it suggests that, perhaps we won't need boosters, perhaps not this year, perhaps not for a couple years. I don't know, perhaps not ever. We'll find out.
We'll find out. So that's really fascinating. This is at the level of cell line development.
Absolutely.
That they're studying this. And this was with the Pfizer vaccine.
This was with the Pfizer vaccine, and this was from Washington University in St. Louis, a highly respected organization. And Nature is a fantastic journal.
It is. I think some of us recently read an article that suggested, it was not referencing this article, but it said, in the case of Pfizer and Moderna, a booster may not be necessary. So we'll see. Sounds like that's saying the same thing.
Yep.
All right, very good. Fred, we talked about blood donation. So I went on the American Red Cross website today, and I put in the 12208 zip code, which is Albany, and I said, show me places where there is blood donation opportunities in the next 5 days within the radius. And there are 5 different places in the next couple days where you can do it. Everett Road, Wolf Road, Crossgate. So I know we have one coming up in a couple weeks, but there's opportunities today
Right now.
and this weekend to
Right now.
give blood.
And it's really important. The summer is always a difficult time with the blood supply.
Right.
This year is particularly short. I think there haven't been as many drives because of COVID leading up to this point. So it's really, really important.
As an academic medical center, as a children's hospital, as a trauma center, we see this all the time, the
Yes.
importance of blood. The types of things that we do on this campus, taking care of trauma patients, the complex surgical procedures, the blood, the need for it is so obvious to us.
So, you know, Dennis, the audience probably doesn't know how much blood we use in the medical center
Go
every
ahead, tell
day. It's upwards of 100, sometimes 110 units of blood
Yeah, per day.
per day.
Per day.
Per
Yeah, it's
day.
incredible. So July 13th is the day here,
Tuesday.
and opportunities out in the community as well.
That's right.
So we mentioned it's somebody's birthday today. They're 1 year old. So 1 year anniversary of a very important hospital joining the Albany Med Health System.
And that's Glens Falls Hospital in Glens Falls, New York, about 55 miles north
Yeah.
of us, right up the Northway.
Yeah, fantastic hospital, wonderful staff, great, care delivery in that region. Today also is the first day where the emergency department at Glens Falls Hospital is being run by the same department that runs the emergency department at Albany Med, same faculty. So the Albany Med Health System integrated on this campus in Glens Falls when it comes to emergency medicine care, which is great.
Shout out to Ashley Teleski.
Yes.
She's the vice chair for community services
Yes.
within the emergency department, and she's been on point to make this happen.
She's been wonderful, working with our chair, Dr. Dennis Posey, and up at Glens Falls, Doug Gerling, who actually was a graduate of our emergency
Yeah.
medicine residency here. So great partnership there. And so, Fred, we have some exciting news here. Albany Med was recently recognized nationally for its efforts to improve childhood immunization rates. This is something that was done in cooperation with the University at Albany's School of Public Health.
Yes.
And promoting pediatric primary prevention challenge. And one of our very incredible physicians who specializes in adult and pediatric medicine led that effort.
And that's Danielle Wales, who's been with us a number of years
Yes.
now. This is a terrific program. It is from Health and Human Services.
Yes.
And it's really going to make a difference in our community.
So congratulations, Dr. Wales. I know there were others that worked on this important initiative. Thank you all. Increasing pediatric vaccination rates is
Yes.
something we definitely strongly believe in. It's Thursday, length of stay. Fred, how are we doing?
So let's throw up the graph. You can see we are continuing to slowly drift down. We're at about 5.7 days length of stay. Still a little spread. That dotted line is total. The solid line is not counting the COVID patients. Little spread between them. Again, I sound like a broken record, but
Yeah.
that's on purpose. This is important for patients to move them as quickly as is appropriate to the next venue of their care so they don't spend extra time here in the hospital, and that creates the opportunity for us to care for more patients who need us.
All right, Fred, thank you very much for that. Lastly, there's another birthday. So I've been sitting here doing the math in my head. I hope I get this right. 245 years old this weekend.
I think you're right. I think you're right, yes.
America.
1776.
So America. So
America.
4th of July, a couple things to mention. Number one, many places will be shut down for the weekend celebrating, but we're not going to be shut down. And so
We'll be
to our
here.
staff who are working here on this holiday weekend, we thank all of you. 24/7, 365, 366 in a leap year.
That's
we're
right.
here.
Here for our community.
And then 4th of July does bring with it certain injuries and things that we want to warn people to avoid.
Yes, so fireworks are fun to watch, but can be dangerous. Please be very careful. There's going to be fireworks down at the plaza.
Right.
The state puts them on every year. So if you want to enjoy fireworks, find a place to watch those.
Watch them. Or if you're going to do them and they're legally allowed, just be super careful,
careful.
and don't let children do them on their own.
That's right.
Yeah,
That's
for
right.
sure. All right, that'll do it. We'll be back again next week.
Next week.
Sounds good, Fred. Thank you very much. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.